restrictions around social distancing is to allow the city to take early steps to getting back to a new level of normal. We don't know exactly what that new level of normal will be. And so it may include loosening some restrictions so that perhaps different types of businesses may reopen, so that we can maybe have some very small number of gatherings occur, all the while maintaining the preventive measures that we have put in place from the beginning with regards to hand hygiene, with regards to covering your mouth and your nose, likely continuing to recommend the use of face coverings for individuals that are high risk. But the most important thing, Mr. Mayor, I think is really critical that you said is that we need to really take measured steps, because I think what would be detrimental to this response is to have those measures come off too quickly, or have New Yorkers feel like everything goes back to normal and we have a resurgence. That, I think, would be the most detrimental to this response.
Either doctor, you want to join in? Open chair, you're good? Okay, go ahead. Who's next?
Next, we have Anna Sanders from the Daily News.
Hi, Mr. Mayor. Can you hear me?
Yes, Anna.
Yes.
So you've repeatedly said that you don't want to go into details about how the city is handling the bodies of people who have tragically died of this disease. For a week now, I have been waiting for specific answers from the medical examiner's office about this process and what the city is doing. I have not gotten specific answers for many of those questions. It's been several days. I've followed up many, many times. And I just wanted to see if there's any way you can promise to me that all of my questions will be answered, outside these public briefings, because if you're not going to answer these questions, then your staff certainly should. And I really do think I want to say that for people who might lose someone from COVID-19, they would probably feel a little better to find out what's going to happen before they are, mourning someone. So if you could
Anna.
Please get your staff.
Yeah, Anna, I appreciate that point a lot. The reason I don't want to get into sort of deep and graphic discussion on this issue is I just don't think it's fair to New Yorkers, and I don't think it's fair to families who are grieving or families who are afraid to spend time talking about something very painful. And I think the dignity that we have to give to all families who are suffering is not to make this a public issue, and an issue, that causes graphic descriptions publicly and blaring headlines and pictures of dead people. I mean, I do understand what a free press has to do in a crisis, but I also think there needs to be real sensitivity to the families that are suffering. So I think the number one question to me is, are we able to address this painful reality? My answer to all New Yorkers, yes, because our Office of Medical Examiner is very strong, very professional, nationally renowned. We've given them every resource they need. There's still going to be challenges. There's still going to be delays, but we'll support them with whatever they need. And we've gotten tremendous support from the federal government of all the areas where I've asked the federal government from the White House on down to help us. This is one where every single request has been answered. Everything we've asked them to send has been sent. And we clearly have, painful but real contingency plans to deal with anything that might come up ahead, but with a very clear standard: dignity for the families. Every family is treated individually. God forbid we lose anyone, but they will be treated, their body will be treated individually and specifically. That will be something we can do with each family. And some of the rumors and some of the reporting have suggested something much more horrible and inhumane, and that's absolutely false, and it should not be reported. With that, to your question about specifics, I agree with you that if there are specifics that can be answered, not here, but in another setting, it is appropriate to get you answers. But I don't know every question you've asked. I can't tell you every question our folks feel is appropriate or can answer this time, but I can tell you that our team here at City Hall will follow up with you, and every single answer that is available and appropriate to give and is specific, we'll make sure to work with the medical examiner's office to get you those answers. And this morning I have, thank you Freddie Goldstein. Freddie will follow up with you this morning to make sure we can give you all we can. Go ahead.
Next, we have Julia from the Post.
Hi, Mr. Mayor. Can you hear me?
Yes, Julia.
Hi, good morning. So, you're talking about we're going to be going, through May, maybe even June. So I'm wondering when you're going to make a call about schools, given that I guess for now they're closed through the end of April per the governor's order. And then if you can just touch quickly on why we didn't have that real-time data that we're going to have on Monday. I know it was a wartime footing and everything, but you control a vast bureaucracy with hundreds of thousands of employees. Why couldn't we have gotten this information earlier?
Julia, it's the same on the first point about the schools. Series of conversations happening right now to decide, do we have one last chance to open them up, in person before it's too late for the school year. School year goes to, the last few days of June. Do we have a realistic opportunity to get the schools back up for a meaningful enough period of time? I think we are a couple of days away, 2-3 days probably away from getting to that decision. You're right that for sure April's already gone in terms of our in-person education. We'll decide soon if we think there's a window to still save any part of the year. And we'll obviously announce that as soon as that decision is made. The question of data, look, I'm only going to keep this simple. I think what I've said repeatedly is the reality. This has been a wartime footing. We are dealing with a pandemic. We are dealing with something no one has ever experienced, any of us, in terms of how you deal with a brand new disease, ferocious disease that has hit us extraordinarily hard with no playbook. We're doing our damnedest to do the most important things. And that means saving lives and protecting the hospitals. And that's been where the energy's gone. And in some cases, there was some readily available data. In other cases, it wasn't as readily available. It wasn't as consistent as we wanted. We weren't sure that putting it out would not confuse matters. And that was a real concern. That wasn't going to be accurate and consistent enough to shed light rather than create confusion. And when you're on a kind of wartime footing, you have to be really careful about that. We're now convinced that this is the most important data, the clearest data, and that we can provide it on a very regular basis. And we think, as we've also experienced this, and the doctors, I'm taking from the conversations we have daily, so I'm trying to kind of translate them from doctor into English here, but and you all anyone can add. But I think more than ever, having fought the fight, and one of the things Dr. Barbeau said weeks and weeks ago, it feels like years ago, like when the disease detectives were dealing with the first cases, they were also getting a whole lot of information about what was truth and what was fiction, or what was more true and less true compared to the international literature or the experience other places. We're having our own particular experience. But we've also learned a lot about statistics, if you will, along the way. Which measures are more important and tell us the most, which have been less crucial to understanding the picture, which have been more accurate, which have been less accurate. There's a lot of different measures out there. Some we have found to be lagging more, others are more real time. These, we are convinced, are the ones that will tell us what we need to know and that we can produce for you constantly in real time. So, long answer to say, I'm just not going to go back and litigate the past because we're fighting a war right now, but that is the truth. We now have confidence that these are the right measures and we can provide them to you regularly. Anyone want to add, or if I have translated?
You got it just right.
I translated. Okay, good enough. Go ahead.
Next, we have Joanna from News 12.
Good morning. Can you hear me?
Yes, Joanna.
So we understand that you spoke to people one-on-one yesterday outside Lincoln Hospital, people who were demanding for more testing in the Bronx. Can you tell me a little bit about what you spoke about with people who you spoke with inside the hospital, and honestly, just your reaction?
Yes, absolutely, Joanna. Well, first of all, I want to thank those 3 individuals I sat down with, and I want to thank them because it was a very important conversation. But the reason first I was up there, I want to focus on, I've spoken to all of you a lot about getting military medical personnel for the city. There's been progress I still want to see more. I've had this conversation with the president, the defense secretary, and many others. We do have the comfort here. We do have military medical personnel at Javits, but now we have about 300 also directly going into our public hospitals. And I'd like to see a lot more because our public hospital doctors, nurses, healthcare workers need support, and the medical military folks are top of the line and they can plug in right away, and we need them. So yesterday I was with doctors and nurses and respiratory therapists from the Air Force, all starting their efforts at Lincoln Hospital, which has been one of the toughest hit in the whole city. And I got to tell you, the healthcare workers at Lincoln Hospital were applauding them, and the Air Force doctors and nurses and therapists were applauding back, but literally applauding back. For the healthcare workers at Lincoln Hospital to literally see the Air Force arrive, to see the cavalry come. And it was very moving to me. Dozens and dozens of healthcare professionals in their fatigues, people who serve this nation. They were from all over the country. Literally, I asked them to call out the states they were from. It was California, Colorado, Florida, you name it, Michigan. It was so inspiring to our healthcare workers to see those reinforcements arrive. And as I was walking around the hospital, to see them all over the place, like plugging in immediately to help. What a shot in the arm. But Joanna, there were 3 people who, when they saw I was there, they called out and they said they were really concerned and they were having problems and they wanted to talk about it. And I said I wanted to hear what their concern was. And what they really talked about was a lot of the same disparity concerns that we talked about yesterday. And feeling like there were a lot of people in the city who needed help getting more information, particularly if they didn't speak English. There were a lot of people who were afraid, and the individuals I talked with spoke a lot about immigrants, particularly undocumented immigrants, who have been pushed away. And unfortunately, this is what President Trump and the federal government has done, and ICE has done, and it's been horrible unto itself. But another thing we've been warning about for a long time before this horrible disease is pushing undocumented people away from healthcare, away from education, away from things that they had access to is dangerous to everyone. When we announced guaranteed healthcare in this city a year and a half ago, we said explicitly it was also for undocumented New Yorkers because they're our neighbors too. 500,000 people are part of our community. But what the Trump administration did kept scaring immigrants, undocumented and documented, from getting the help they needed, like the public charge policy. There's so many things that push people away from care and away from help. So this is what a lot of the conversation is about, that we have to somehow make up for that with more grassroots outreach, more information, particularly in other languages, and just a recognition that a lot of people, they understand there's a crisis going on, but they don't have enough information on how to respond to it or where to turn for help. And that's why that telephone service we're going to start, where people can reach a clinician on the phone in many languages, is going to be crucial. We have some of that, but we need a lot more. So that's what the conversation was about. And I thanked them. I told them, even though they had, when they first met, they were agitated. I said, you're actually helping me to see things that we're feeling, but you're giving it, some real specific shape that's going to help us to deepen our strategies. So I was very thankful to them. Go ahead.
Next, we have Alex from Chalkbeat.
Hi, Mr. Mayor. I wanted to ask a question about student attendance. Some other school districts have already started releasing some top-line attendance data. I know that the Department of Education has started collecting that information, but given that it's, we're already in week 3 of remote learning here, there still hasn't been any data released publicly. I'm wondering if you've seen any top-line figures about student attendance that you could share, or if you could provide a timeline for when those will be provided.
Thank you, Alex. Yeah, we should provide that. I think, again, what I'll remind everyone, this is the single biggest effort, the single biggest experiment in distance learning in the history of the Republic, all put together in a matter of days. So what the folks at Department of Education are doing, what our educators are doing, is really heroic in another way. And it's reaching a lot of kids, but there's clearly an issue with attendance. We know a lot of kids still don't have the devices, and that's been an ongoing effort. We know a lot of kids aren't logging on as much as we want them to, and that's something we projected. I said it very bluntly. It's one of the many reasons that closing schools was a painful decision, is that we knew even with the best distance learning, we didn't have every kid ready for it. We didn't have every teacher ready for it. And we knew, I know plenty about kids and particularly teenagers, that you were not going to get not only not perfect attendance, you were going to have a real problem keeping attendance if you couldn't supervise. So we will get you data. I imagine what it will show, and what I've gotten is really only very top line, which is it's a problem. It's a problem we predicted, unfortunately. It's a problem we assumed. And I think we'll get better in the sense of more kids will get devices. And in a world where kids don't have a lot of choices of what to do because they're sheltering in place, hopefully more and more will choose to engage the distance learning. But there's an issue there. We will get you data as soon as it's ready.
Next, we have Gersh from Streets Blog.
Mr. Mayor, a very joyous and weird Passover to you.
Gersh, I want to wish you Aziz and Pesach. And I want to see you one day throw me a curveball and ask a non-transportation issue. I really believe it's in you.
It is in me, but as you know, I cover a very narrow lane, and this is a COVID-related question. You know, we all know that a budget is not just numbers, but it's an agenda, a signifier of priorities. You issued some peg cuts that slashed Vision Zero programs by about $10 million, yet made no cuts to any Department of Transportation expense budget allocations for road building or maintenance. So I'm wondering what that says about your priorities during this crisis and beyond this crisis, that cyclists and pedestrians are sacrificing key programs, but drivers are not.
No, it does not say that. And I perfectly fair question, but it doesn't say that because, and I would contest you on your understanding of what's been put out or will put out clear information. A lot of work at the Department of Transportation has to continue because the most basic maintenance, like keeping, the classic New York question of keeping our bridges intact and strong, road maintenance that's about immediate safety issues, all of that has to continue. But there's a lot that isn't continuing as normal. And clearly, the Vision Zero work required a certain amount of consistency in the overall work on our streets. If that was being reduced in different ways, it was going to affect our ability to do as much Vision Zero work as quickly. So in truth, I think your initial assumption that everything else is the same except Vision Zero couldn't be farther from the truth. The Vision Zero work is continuing in many, many ways. As we get back to normal and DOT ramps up more, by definition, we're going to prioritize Vision Zero. But what you're seeing in a lot of agencies in the budget, Gersh, is things that we care deeply about are being held off because this normal operations don't exist. I mean, look at professional training in our schools, something that's been the absolute foundation of how we make schools better. We can't do it if teachers are not in their schools. And there's many examples like that. If you look carefully, and our folks will go over it with you, a lot of things in the budget proposal that's been put out so far are about money that just can't be spent because normal operations are not going on. Hopefully that's a very limited period of time, and then we can ramp back up. But Vision Zero has always been a priority, always will be a priority.
Next, we have Gloria from New York One.
Hello, Mr. Mayor. I wanted to ask quickly two things. One, do you have an update on how the city is handling people who are dying at home? And what I mean by that, I know that I understand your reluctance to discuss some of these things in public, but what I'm simply asking is, we understand that a lot more New Yorkers are unfortunately passing away at home, and that because of the system being so taxed at this time, there are delays. But I am also assuming that there is, as a result of a massive undercount that's happening. So what are the city's plans to count those people? And can you talk a little bit more about how New Yorkers will be able to access this new data that you'll start publishing on Monday?
Okay, yes. I'll start, and then Dr. Barbeau, Dr. Daskalakis, Dr. Varma, anyone who wants to join in on any of the pieces or clarify any of the pieces. Okay, the new data, my colleagues can talk in detail, but it'll just be available on the DOH website is the easy answer. And again, we'll be not only putting it out publicly every day, but talking about it a lot because it's going to be the prism through which we interpret everything. So again, now that we've had these weeks of very painful experience, Gloria, and we have a sense of what we really think tells us the larger truth, we're going to be putting it out and then telling you what we're seeing in it as a regular part of our discussion. On the question of this painful reality for our families. So let me frame it this way because I think it's really important for people to understand. Anything related to COVID-19, my approach to my whole team, to the people in New York City, is whatever it takes to help people and protect people and to support families that are going through this. If we can do it, we're going to do it. A lot of other things that we used to do in this government are going to be on hold, as you just heard, or some things we won't be able to do in the middle of crisis. But when it comes to addressing this crisis, protecting people, protecting their health, protecting our hospitals, making sure people are safe, making sure our first responders are there when people need them, all of these very basic things are going to be the priority. And that's where we're putting our time, our energy, our money, everything. So whatever the Office of Medical Examiner needs, they will get. And one of the first things they said they needed was a huge amount of federal personnel and federal support, and they got it. But they'll get anything they need from us as well. Because I don't want families to go through this pain more than they already are. I want us to make sure to the best of our abilities we can get to families quickly and provide them support. We know that'll be tough at the height of this crisis, but it has to always improve because people deserve, to be treated with tremendous dignity. So that's just to let you know my message is whatever they need that we can get them, they're going to get so they can provide that support. On the question of the data, absolutely. I want to say there's no question in my mind, and the doctors can speak to this, the driver of this huge uptick in deaths at home is COVID-19. And some people are dying directly of it, and some people are dying indirectly of it, but it is the tragic X factor here. And I want us to count it in the facts we're putting out, not because any of us should be involved in that morbid exercise, but we're forced to because we have to be open with people about what's really going on. So I say, let's state what I think is the truth. Yes, those deaths overwhelmingly, not every one necessarily, but overwhelmingly are because of COVID-19. We should count them towards a total. As quickly as we can get the full facts about them and include them in the demographic data, we must. But we understand there's going to be some challenges and some lag in that just because of the sheer nature of the crisis we're going through.
So, Mr. Mayor, if I can add to that, I think, Laura, the only other thing that I would add to what the mayor laid out, which is absolutely correct, is that we are, first and foremost, focused on ensuring that every New Yorker who dies because of COVID-19 gets counted. I think that as a city, it is part of the healing process to be able to grieve and mourn for all of those that have passed because of COVID-19. And to date, we have only been reporting on people who have had the test. We recognize that there are many people who have not gotten the test and may have, as the mayor said, passed for other reasons, but likely in this period have passed because of COVID-19. So we are committed to ensuring that that data goes up on our website. We anticipate that that will happen in the very near future. And we are committed to also ensuring that we maximize the amount of racial demographic data that we're able to report along with that. Though, we are facing some of the same challenges that we have faced with the other data that we are reporting. But the magnitude and the importance of having this data out there so that it becomes part of the healing process for the city once we get to the other side of this horrible outbreak, I think is going to be crucial.
Either doctor, are we good? Or you want to add? Okay, good. Next.
Next, we have Sydney from the Staten Island Advance.
Hey, Mr. Mayor. So Staten Island's political delegation sent you a letter this week calling on you to treat the borough more equally during the coronavirus crisis after you left Staten Island out of the latest surge planning
for the public hospitals and the recent announcement of more military personnel when Staten Island hospitals need these things too, especially at the new South Beach Psychiatric Center. What is your response to the letter? Have you seen it? And do you plan to send Staten Island military medical personnel or any of the free coronavirus testing for healthcare workers? If so, when? And which hotel have you selected on Staten Island to house medical staff and use for more hospital beds?
Okay, on the hotel, Sydney, we'll make sure that's something that's ready to be public, but we do have one hotel ready to go, and we'll add as needed. So our team will follow up because we just need to confirm that that's ready to go public. Sydney, your questions always are framed a certain way. You have every right to do that, but I just want to aggressively disagree with the way you're framing it because I honestly don't think it's fair to the 500,000 people of Staten Island. We have been supplying constantly the Staten Island hospitals. I've been constantly talking to Borough President Otto about what Staten Island needs and what it needs. We're getting it. When we talk about ventilators, N95s, surgical masks, everything we provide, what the Staten Island hospitals need, we are sending them. And I understand the history. I've lived it a long time, as you have, of why people on Staten Island, some people are very concerned about making sure Staten Island is not ignored. But I want to protest when actual constant shipments of needed supplies and equipment are going to Staten Island hospitals. That should be reported too, because it's not fair to the people of Staten Island to only show one side of the picture. It's just not. All the efforts being made to support healthcare workers, to support first responders, also are for Staten Island. Everything we're doing is for Staten Island, like all of the 5 boroughs. So the question of the military medical personnel, first of all, what I said was the hospitals bearing the brunt of the crisis in New York City, and it is true by the sheer numbers, that some of the very toughest situations, Elmhurst Hospital, Lincoln Hospital, Bellevue Hospital, that the military medical personnel going right into the ICUs and emergency departments was a high priority. And I think that was the right priority because those were the places bearing the brunt the most. And we've gotten some of those personnel nowhere near what I'd like to see. I am continuing to push the White House and the Defense Department for many more military medical personnel. And if we get more and more, of course we should be applying them beyond the public hospitals into places like Rumsey, for example. But we don't have that yet. I'll keep fighting for that. The question of the testing, yes, I think this is a very fair question. I did appreciate the point raised by the elected officials from Staten Island that because this is a case where I think the point about not having a public hospital is very fair, where we know that Rumsey in particular handles a big burden making sure that testing as we have it, fighting for that, is available for healthcare workers in Staten Island. I think that's fair. The point, Sydney, and I want this accurately reported, is the as we have it. Right now, we're trying to take what is still too limited amount of testing, use it to address the most serious cases everywhere, Staten Island and everywhere, save lives, protect healthcare workers, protect first responders. We got to keep building that out, and we're continuing to deepen that. So we're going farther with that than where we were even a week or two ago, but it still has to be within the amount of testing we actually have. So presuming we have it, I would love to see a place like Rumsey and ultimately a place like Staten Island University Hospital have that testing as well. We will work to make that happen. The whole thing hinges on increasing our supply of testing so that we can actually use it the way we want to going forward, not just for the healthcare workers and the first responders, but actually to start to be part of those strategies to get down to low-level transmission and no transmission as well.